We welcome you to our channel, Percepta Analytica. In this video, we will mainly talk about vitamin D deficiency, primarily in infants and toddlers. When buying daily essentials for your newborn, make sure you buy vitamin D drops for infants, as daily dose of vitamin D is essential for your babies and toddlers' health. We would like to begin by telling you what vitamin D is and how it can affect human health. Calcium and phosphate are essential vitamins that any human body needs for strong bones and teeth. Vitamin D substantially helps in absorbency of these vitamins, and a body deficient in vitamin D will fail to absorb calcium or phosphate, which can lead to a number of health issues. In children, lack of deficiency of vitamin D can lead to brittle bone disease known as rickets, and children in their growing years may be more prone to fractures and growth problems if they do not get proper nourishment. Vitamin D is also essential for brain development and also for ensuring a healthy immune system. It is accepted that children in growing years continuously require healthy intake of food with the right blend of vitamins, which helps ensure that they remain at their optimum health levels. Vitamin D thus plays an important role in absorption of other vitamins and nutrients. We now come to an important part of our video where we address the question whether infants and toddlers need vitamin D supplements. We often hear that breast milk is a complete food containing everything that a baby needs. However, tests have shown that mother's milk lacks vitamin D. The primary source how we humans acquire vitamin D is through sunlight from our sun, and there are specific times of the day during which vitamin D is best absorbed, like during the first hour after sunrise and last hour at sunset. However, during present times, it may not be possible for every parent to take their children outdoors during these specific times due to work timings, personal health, harsh weather or poor climatic conditions of the region where we live, or simply because we may have a very passive lifestyle, which is why giving good quality supplements to meet a child's growth requirements becomes all the more important. People may argue that vitamin D may also be absorbed while inside our homes, through sunlight which enters through windows, and going outdoors just to absorb sunlight for vitamin D is thus not a necessity. While sunlight may be able to enter through windows, modern construction needs to meet certain design thermal values to meet energy efficiency requirements and also for insulation purposes for better indoor living comfort during extremely hot or cold weather conditions. As a result, some UV light gets blocked by window glass. Our body needs certain rays of UV light to absorb vitamin D. This means that our skin will not be receiving required UV rays through windows or door glass, which is required for formation of vitamin D. For infants though, there may be formula milk brands which may contain small amount of vitamin D. This still does not ensure that your child may be getting the daily required dose of vitamin D, which is why many doctors and pediatricians recommend giving vitamin D drops along with food. The American Academy of Pediatrics recommend babies less than 12 months old should be given 400 IUs of vitamin D, which is equivalent to 10 micrograms. Many supplements come with clearly marked droppers, along with recommended dosage by the manufacturer of the supplement, which should be read carefully as dosage varies from brand to brand. As newborns and children have a weak or underdeveloped immune system, it is important that their bodies should be able to fight at least the basic infections. Vitamin D significantly contributes in development of a healthy immune system. As newborns only consume breast milk or formula milk, there are several pharmaceutical companies that manufacture vitamin D supplements which can be safely blended with breast milk and formula milk. In all cases, it is always recommended to consult doctors and pharmacists who may prescribe suitable vitamin D supplements that can be mixed with breast milk or formula milk. We will now describe the signs and symptoms of vitamin D deficiencies in a human body. Vitamin D deficiency, especially in newborns, is difficult to spot mainly because they are not able to tell their parents what discomfort they feel. Usually, fatigue and muscle pain are common symptoms. However, in many cases, there may be signs and symptoms that will not become prominent until after several months or years. Usually, doctors may prescribe vitamin D tests if your baby has the following symptoms: frequent infections or illness, poor growth, frequent bone fracture or bone tenderness. A blood test may be prescribed to screen for vitamin D deficiency, and this test usually checks the blood for 25-hydroxyvitamin D parathyroid hormone, and calcium levels. As vitamin D is essential for a baby's growing needs, parents need not wait for signs and symptoms to appear for giving vitamin D supplements. Rather, recommended dosage of vitamin D supplements should be given regularly. We would also suggest and encourage our viewers to maintain an active lifestyle and include outdoor activities. Our bodies naturally produce vitamin D when exposed to sunlight. About 15 minutes in the sun a day is adequate if you're fair-skinned. And since vitamin D helps your body maintain calcium and prevents brittle, thin, or misshapen bones, soaking in sun may be just what the doctor orders. And finally, if you like the content of this video, please like, share, and subscribe to our channel so that we can continue making such wonderful videos.